What is the purpose of Style Italian? You both are founded Style Italian. So, what was the main purpose of creating this platform?
Okay, the main purpose after we created Style Italiano was to simplify the life of the general dentists mainly, but not only general dentists, all the dentists that are working daily with restorative and endo treatments, of course. And we try to simplify all the techniques because at that time, a company, they had a lot of colors about composite. We try to simplify using only two different shades. One was a dentin and one was enamel, giving to the people the exact recipe to get the color that you are requested for the restoration. This is only the beginning. After that, we started to work in a different way, collaborating with the company, made consultancies to the company. We are working with a different company in consultancies, and so we start to even design instruments, products, and this is the second branch of Style Italian.
So you were creating examples of different kinds of aesthetic works through Style Italiano. How the young dentists, those who are interested in aesthetic dentistry, how they can involve with the platform?
Very easy. First of all, we do believe that dentistry must be aesthetic. No one patient wants an ugly restoration in the mouth. So for the young dentist, the way to be successful, it is really to create a trust with the patients and to learn techniques in order to be good. And to be good, it means to make good things and beautiful things. So the way to interact with us is just to follow us. We are present on the socials. First, we opened Facebook many years ago. Now we have also Instagram. We have more than 100,000 more followers on Instagram and 300,000 more on Facebook. And of course, through our website, www.styleitaliano.com. So in this way, we love having people posting, coming to us, copying our techniques, and be successful.
Like, is there any monetary involvement to get involved with the Style Italian platform?
Of course, there is possibility because all the people can publish it if they want inside Style Italiano. Of course, we choose the best cases. I mean, all has to be done in the right way. So, but if you do with a nice job, we publish for sure from our community, and we publish as members. So there are different publications. When we publish as member, usually the case has even a history behind, and we publish it even in our website. We publish the teasing on the social and the full article into our website that at the end of the year has more than 2 million visits. So it's a very great success.
Moreover, today we have the family. So this is the way really to be closer to us. The possibility to having a membership on Style Italiano, being closer to us, having specific education directly from us, having visibility because of us, so having special discounts. So just the membership is the way to follow us, and the people, they just need to go and to come and to be closer.
So, Dr. Angelo, I have a question to you. That is, you are working with like evolution of bonding.
Yeah.
So, what motivates you to work in this topic?
Because I was doing adhesive dentistry every day, and at that time I say, okay, to do this job in the right way, I need to understand how the adhesive they works, and if all the adhesive they work in the same way. Unfortunately, not all the adhesives they work in the same way. That's why I strongly suggest people to work with a major brand that usually they have an history behind adhesives. So I mean that for sure the next one will be better than the previous one. If you have a new company, probably it's not so easy to create the perfect adhesive since the first time. So that's why I was in love to start to test all the adhesives available in the market, to choose what for me is one or some of the best of this adhesive, because I want not to fail, not because of me. If I fail, it has to be because of me, not because of other story.
Okay. Dr. Walter, what do you think? What are the main challenges that young dentists face when they want to do restorative dentistry?
In my opinion, it is the connection with the patients. I mean, I see many young dentists that are very talented, very good skill, but they are not able to connect with the patients and to make the patient feel to be good and to trust because of that. So I believe that now the new dentists, they are too technical, but they are losing the capability to get in contact with the patients correctly, ethically, and smartly. If they don't do so, whatever they do risk to be, let's say, undervalued. So I just push all the young dentists to understand that they have a patient which is just far 20 centimeters from their own nose, feeling everything and understanding any kind of small situation ongoing. So it's not just a question to put some brown in the sulcus and believe that the patient will be open mouth and thanking you forever. Just we need instead to show to the patients the way in which we care about him in a way. So it's not a question of material, it's not a question of skill, it's a question of good communication.
So, what is your ultimate goal about creating this platform, Style Italian? What do you want to achieve?
Oh, very simple. The idea was to elevate the quality of the average of dentistry. So we are not caring much about the top of dentists, which are just a few, but we care about elevating the average of dentists. You know, dentists are doctor. They are doctor investing in their own clinic a lot. They are marketizing themselves. They are caring about their own protocols and their own staff and their units and whatever. The idea to elevate their own quality and to serve the patient positively, it will help the patient in understanding that they can invest correctly in dentistry and trust dentist as a pure doctor.
Okay, so that would be my last question, and this question is for both of you. That's nowadays AI or artificial intelligence is taking all the sectors. So how do you think how AI will bring impact in our dentistry?
We strongly believe that AI can help a lot to the dentist. The problem is that AI doesn't do what you must do. That is totally different. You must teach to the AI to learn and to think about you, because otherwise the answer that you have from the AI is not the right one. So it's very difficult for people to interact with AI. And the moment I see you use that AI, that is totally wrong. So it doesn't help you a lot, the AI. Of course, I can, because if you start to teach the AI, at the end you have 300 prosthodontists, 200 periodontists that are with you with the AI. You are alone in your office, but you have to teach to AI, which is your way to manage the patient, to manage the restoration, to manage the treatment plan. And unfortunately, with all the young people that want to be only collaborator in the study, the diagnosis is very difficult. And you cannot give to the AI the idea of the diagnosis, because of course you are the dentist. So in my opinion, you have to stay just a little bit, working in a different way. Of course, the AI is a good tool, but nothing more at the moment.
So what do you think?
In my opinion, will coming the time that the AI will make diagnosis and treatment plan,
but not
because of us.
You. Not instead of you.
Sometimes, dentists, they are too much individual in their own choices. Yeah. And that's why the literature in dentistry, it is in so low level, because it is based on the individual solutions, individual facts, individual publications. So I believe that's a way to standardize some diagnosis, and then treatment plan would help everybody in understanding. So actually something that without AI we do. We try to standardize some clinical points in order to having everybody to do so. And when you see that the majority of people, they do that way, they are successful.
We cannot leave the AI to do something that we have to do, in my opinion.
Because
so we have to participate.
But because at the end, there is the skill of each dentist after that. Even a good diagnosis or whatever, then after there is the hand of the skill of the dentist, of course, which is a fantastic behavior and also a positive point.
Okay. So if a young dentist want to align himself in the level of global dentistry, what would be your advice?
Very difficult question.
What skills he should achieve to stay aligned with the global dentistry?
For sure to make it simple. Otherwise, if you are starting, if they continue to follow people that are doing unbelievable things and you are not able to do it, you lose all the time. You must follow people that is concrete and teach you exactly how to manage your patient, because don't forget the goal. The goal is not the dentist, the goal is the patient. And we forget many times that our goal is the patient, not our ego. That's totally different.
I totally agree. I mean, as I said before, the patient is the focus. And if you are able to do so, we will simplify our techniques as well. We will make everything much faster and reliable. And this is, in my opinion, the point. On the contrary, when you're young, of course, you feel to be good and great and to go for the most difficult part. But really, from the experience, I believe much and more that following the patient's needs, you can categorize patients in some situations, and then will give you the way to be successful.
We have to enlarge our portfolio for our patients.
Thank you so much.
Thank you to you.
Nice interview, and we have learned so many things from both of you. And thank you so much. Thank you.
Pleasure.
Pleasure for us. Great. See you in Bangladesh.
See you. Thank you.